Good evening, friends. For many patients, we have seen the veins below the tongue, veins under the tongue. So veins under the tongue are called sublingual veins. So when we are looking the tongue and we are going on below the tongue area, and we can see the veins. These veins are called sublingual vein. Okay, now, so I will tell you, try to see your sublingual vein if possible. Okay, see the mirror and tell me whether it's visible or not. आप अपनी जीभ के नीचे की जो वेन्स हैं उसको देखने की कोशिश करिए एक बार शीशे में. Let's try to see the sublingual vein, whether it's visible or not. And try to see the color, whether it's the red color or the purple color. Red color, purple color, dark color. And try to see one more thing, like we have seen the varicose veins, like many person are getting many spider veins, crooked veins. So few person also might be having some crooked vein, spider vein below the tongue. So try to see that. So try to see the veins below the tongue. Try to see the color of the veins below the tongue. Try to see if there is a crooked vein like the multiple spider vein or the varicose veins. Okay. So now remember one thing. Generally, veins are not visible. But if they are visible, generally veins are not visible. But if they are visible, it means, okay, now we have to take care of ourselves. Now, if they become purple, so what is the meaning of this? When there is a blood stasis in the body, and when this blood stasis is in the early stage, so it is reflecting on the veins, sublingual vein, and after some time, it is coming on the tongue. So first it will reflect on the sublingual vein, and after some time it will appear on the tongue, that blood stasis. And if you see the multiple spider vein, now the problem is more. If you can see the multiple crooked vein, spider vein, the problem is more. So when we talk about the sublingual vein, in the normal circumstances, these veins are not distended. These veins are not dark in the normal circumstances. And even you can see very hardly outline of the veins. Rarely you can see the outline of the veins. So generally these veins are not visible. You can see in this image. It's clearly visible and it's clearly distended. In generally, they are not distended. But if they are distended, means there is a problem. So the purple color of the veins under the tongue, what is the clinical significance? If the purple color is coming on the veins below the tongue, what is the clinical significance? The clinical significance is they are showing some abnormalities. So if the veins are distended and shiny, they are showing some abnormalities. When the veins are in the purple color, and we know the purple means blood stasis. So they are showing blood stasis. So when the blood stasis is happening, first it's coming on the sublingual vein. After some time, it's coming on the tongue. So mainly this is telling about the blood stasis in the upper barmer and the middle barmer. So upper barmer means till the chest cavity, like the problem of the lungs, the problem of the heart, the problem of the brain, that is the upper barmer, means area of the chest, including chest, like the lungs, heart, brain, that is upper barmer. And the middle barmer means liver, digestion, stomach, and all. So that is middle barmer. So if you can see the purple color sublingual vein below the tongue, they are representing there is a problem in the middle barmer or the upper barmer. There is a blood stasis. But if you see the crooked vein, too much vein, too many vein, like the spider vein, the problem is serious, right? So the purple color veins below the tongue are not good sign. It's not the good sign. You need to take care. You need to work for yourself and remove the blood stasis. And remember one thing. This is the vein. Now, when the vein become distended, suppose this vein become distended. The distended vein is the sign of Qi deficiency. Qi deficiency. If the vein is bulging, distending, it's the sign of Qi deficiency, remember. So you can see the tongue, then you can tell the person, fold the tongue and see the veins. If the veins are distended, elevated, bulge, it's the sign of Qi deficiency. And the dark color showing blood stasis. And especially I told you, this is telling about the condition in the upper barmer, in the middle barmer. So most of the time lungs are involved, heart are involved, brain are involved, and sometimes middle barmer means liver are involved. So the distended sublingual vein telling about the liver blood stasis, heart blood stasis, lung blood stasis, the blood stasis in the upper part. It's representing mainly the problem in the upper body. Now, if you look at this tongue, it might not be that much clear. But in this image, we can see there are sublingual veins are visible. They are the sublingual veins, they are visible. And they are yellow in color, yellow. Okay, visible and normally visible. We can consider normally visible. But in the second image, they are very dark. So they are dangerous. They are showing some abnormalities. They are showing the blood stasis. Let's see this image. Let's see the image number 1. Now we can see the sublingual vein here and the sublingual vein here. Slightly dark. Okay, very slightly dark. Slightly dark. But if we go to the second image, now the sublingual vein are there, but they are distended. Now we can see they are distended. So the distended means deficiency of Qi. Distended sublingual vein means deficiency of chi. So distended and dark means blood stasis. So distended and dark means blood stasis. Most of the time in the upper Barmer and the lower Barmer. Now look at the image number 3. So right side having no much problem, but if you go to the left side and look at this area you can see very, very dark sublingual vein. Very, very dark. So they are showing severe blood stasis. So more darker the vein, more the problem. Lighter the vein, less the problem. Let's see this image. Now in the first image, we can see, if you see yellow is color, sublingual vein. Yellow color is the color of heat, right? Color of heat. Yellow color and the shiny. So the yellow color is the color of heat. So this is the damp heat because shiny, damp heat. Maybe we'll understand later on, but right now my focus is only the vein. How the vein look like. If you see the another image, then we can see the purple sublingual vein. Purple sublingual vein. Right? So you can find out the purple color look like this. Now look at, very clearly visible. Now tell me, this person number 1 or the person number 2 who is having more blood stasis, tell me. We can see the sublingual vein in both the person who is having more blood stasis comparatively. The first person having sublingual vein, even crooked vein, multiple vein. The second person having darker the area, darker the spots. Who is having more problem? Yes, both are having blood stasis, but this person having more problem because darker the vein, more the problem. And we will directly tell blood stasis, especially in the upper Barmer and the middle Barmer. Upper Barmer means lungs, heart, brain. Middle Barmer means liver. So sublingual vein, try to understand 3 conditions. Condition number 1, 2, and 3. The condition number 1, dark purple veins. We have seen dark purple vein. Like see this. This is the dark purple vein. Dark purple vein. The condition number 1. So the dark purple vein means blood stasis in the heart, lungs, or brain. So the dark purple veins means blood stasis in the heart, lung, and brain. So the meaning what blood stasis do? Blood stasis create blockage. So there is a hardening of the arteries, hardening of capillaries who supply the heart, who supply the brain. So what the problem will be happening? Maybe there is a blockage of the heart, the blockage in the coronary artery, blockage in the brain. Person is having some problem of the brain, not receiving good amount of chi because of the blood stasis. Blood stasis means the very deep level of blockage, energy is not able to flow. That is the blood stasis. So the dark purple vein means the heart lungs are not getting enough blood, enough chi because of blocked artery, hardening of the artery. Even the brain is not getting good chi because of the hardening of the arteries to the brain. Now the second condition, condition number 2. So condition number 1 means just a blockage, so no good energy supply. The condition number 2, distended and crooked veins. Like see, this is the distended vein. And you can see here multiple crooked vein, like the spider vein. So now, if you see the distended vein, distended and dark, both should be there. And the crooked vein, it means the disease is severe. The same thing, but disease are severe. The veins are like a earthworm. So this is the more severe condition, more serious condition. So the condition number 1, only the purple vein. Condition number 2, plus distended or spider vein. Condition number 3, we also find some nodule on the brain, like the particles of the wheat or the particle of the rice, like the rice grain, like the wheat grain. We also having some nodule on the brain. So the meaning of nodule, it's showing there is a blockage in the arteries, especially there is a no good supply to the heart. So the dark nodule on the veins, if the dark nodule on the brains, like the grain of rice, like the grain of wheat, it's showing hardening of the arteries and the heart disease. So there are 3 conditions. So now onwards, when you are doing the tongue diagnosis, do not forget to see the tongue from the bottom. Tell the person, okay, fold the tongue. Then see the tongue very properly. There are 3 conditions. Condition number 1, purple veins. Purple veins means blood stasis. Energy is not flowing properly to this part or upper part or liver. Or there is a blockage in the arteries, hardening in the arteries, capillaries, blockage in the arteries supplying to the brain. Condition number 2, purple veins and also distended or even the spider vein condition is more severe. Condition number 2, maybe everything is good and normal. There is a no distended vein, there is a no purple vein, just a normal vein, but we have purple nodule, dark nodule. So dark nodule or the purple nodule on the veins are telling about there is a blockage in the arteries or blockage in the capillaries, right? Got it? Understood? Clear or not? Clear or not? Anyone having nodule below the brain? Anyone having nodule below the tongue? Send the image. If you have beautiful nodule on the sublingual vein. Okay, have you sent? Where is mobile? Okay. If anyone having nodule, kindly send me. We want to see the nodule. Yeah, good. Good nodule found. Now you can see there is a wonderful nodule below the tongue. Anyone else having the nodule, send me. So let's see this. Can you see the nodule? So these are the nodule found on the vein, on the side of the vein, on the vein. So nodule are telling about there is a hardening, there is a blockage, hardening of the arteries. So the dark nodule on the vein, a small nodule like rice and wheat grain indicate hardening of the arteries and the heart disease. Hardening of the arteries and the heart disease. So this is the nodule, very clearly visible. Very clearly visible, multiple nodule. Fine. Anyone else having some beautiful nodule? Okay, there should be good light if you want to see the image of tongue. Like Monica ji has sent a very good picture. Oh, got it. One more nodule. See. So look at now. So can you this nodule? Nodule here. Nodule here. So the nodule are indicating that you should be aware there might be hardening in the arteries of the heart. Okay, even the veins looking like purple in color. We can see the vein looking like purple in color. So the purple vein and the more purple vein on the right side and the less purple vein in the left side. So you should also take care of chest, heart, especially lungs. Because the more purple color we can see on the right side and less, very less purple color on the left side. Anyone else having nodule? So now we understood what is nodule exactly. Now one more thing I want to show you here. Let's see this. Now if you look at the veins here, the veins are distended. Veins are distended, right? We can see the distended vein here. You can see the veins are distended from many parts. So distended vein. What is the meaning of distended vein? The distended dark and crooked veins. It means hardening of the arteries or the high blood pressure. So hardening of the arteries or the high blood pressure If the vein is like a earthworm, then condition become more severe, but it's not like a earthworm. It's a just distended and the crooked vein, right? So if the vein are distended, dark, take care of heart and high BP. A nodule means blockage. So this is the heart. The arteries are supplying the heart and there might be blockage if the nodule is present. Nodule means hardening of the arteries. Hardening. Anyone else having some beautiful tongue? Oh, wonderful. Got one more beautiful tongue. Okay, great. Excellent. Now we got many tongues. Let's see this. Now look at this tongue. Now we can see very clearly purple tongue, purple sublingual vein. And this vein is distended on the right side. Distended on the right side. Distended vein on right side. But both the side vein are purple in color. Right? So everyone kindly post your problem so we can correlate clinically. It will help all of us. Okay. So I will show the presentation in the next class with the problem. If you have some problem, so we can correlate clinically because this purple tongue is showing the blood stasis. So what problem you are facing? Okay. So let's see now. So nowadays blood stasis become very common. It's became very, very common. Let's see this. We can see the blood stasis on the right side as well as on the left side. We can see the clear purple veins. So the purple veins means blood stasis. The meaning of purple veins means blood stasis. Let's see this. The dark purple veins means blood stasis in the heart and the lungs. And in some cases, there is a hardening of the arteries in the brain as well. So don't ignore the blood stasis. So it's the clear blood stasis we can see in this image. Even we can see here, the vein is little distended on some part, right? Distended on some part. So need to take care. Few persons has not sent the clear image, so we can't discuss. So now look at this tongue. We can see the purple vein on the right side, even the purple and distended vein on the left side. Purple and distended vein on the left side. This is also the blood stasis. So the purple and distended. The distended dark vein are showing there is a disease is severe, blood stasis is severe. So need to take care. Now we will see a very clearly bulges. Now we can see this in this image, very clearly bulges. Let's see in this image. If you see this image, the purple vein are distended here. The purple vein are distended here. So the blood stage is in the severe condition. Need to take care. Need to resolve this problem. Now look at many person having blood stasis only on one side of the body. So the tongue will be showing blue color only on the one side of the body. If you see this image, you can clearly see right side is normal. Only the left side is having the problem of blood stasis. Right side is okay. But if you see the left side is having blood stasis. Okay, this is the left side, blood stasis. In the left side, there is a, we can see the blue veins very clearly. Okay, so the person is having blood stasis on the left body, left side of the body. The few images are not clear, but even after that, I would like to show you one image, because here we can see the spider vein. Let's see this. If you see here, definitely we can see the purple vein. And also it is looking like a spider, crooked vein, crooked spider vein. So what we have seen here, look at the second, distended dark crooked vein. It means hardening of the arteries or the high blood pressure, hardening of the arteries and the high blood pressure. So the darker the color means more the blood stasis. Darker the color, more the blood stasis, right? And all the person I have not discussed, so they post their problem. So we'll do the comparative clinical study. Then we will find out very clearly the real essence of blood stasis. All the other tongue looks like similar, but oh, that's a great one. Oh, so I would like to show you one more tongue. So look at this tongue. Okay. So you can see very clearly highly bulges. So the bulging of the vein is showing the deficiency of the chi. Bulging the vein means deficiency of the chi. So even we will discuss more, don't worry. With the clinical study, we will see the tongue posted by you in the group, and we will keep on seeing each and every tongue, and we'll do clinical study, comparative clinical study, right? So enough for today. Now we'll do the break for 2 minutes before Hindi recap. आप सभी लोग अपनी जीप की फोटो भेजिए, जीप के नीचे की और आपकी प्रॉब्लम के साथ, तो हम कंपैरेटिव स्टडी कर पाए. ओके, तो चलिए 2 मिनट का ब्रेक करते हैं, फिर मिलते हैं हिंदी में.